We're starting the session, so thank you so much for attending this session. My name is Leonardo from Duarte, and I'll be talking about ethical and responsible AI in healthcare. Actually, this is a presentation about ethical and responsible AI, and healthcare is just a motivation for the workshop, and this motivation came with recent cooperations with Livia Couto Rodrigues, who is here attending this workshop in person. So thank you so much, Livia. But I will try to show, first of all, the challenge that we have in healthcare regarding ethical and responsible AI. Thank you. And then provide an overview of this field for those who are not familiar with. And finally, what we are doing, so two examples of things that we are doing here at BUs, okay? So, I mean, why ethical AI matters in healthcare? We saw today the very nice, interesting presentation of Rodolfo, and he mentioned some points about that. For example, there are problems related to unfair and or opaque decisions. This is a limitation in health. People would like to know why they are, how they are deciding, for example, to prescribe diagnosis or a treatment. And I just put here several examples. For example, we also can have bias in diagnostic models. The risk predictors, we can have unfair risk predictors. As I said, the lack of explicability to professionals and also to patients. And of course, a last point, not the last one, but the last of this slide, there is a problem in healthcare, it's allocation of resources. And sometimes we want to be fair in allocating these resources. For example, a vaccine. We must decide which cities will have the vaccines first, and how to decide is a decision problem, and how can we decide this in a fair way. But of course, fair is a tricky word. We must define, we must have some concepts to introduce this problem, and I'd like to pass these concepts. The first one is, I mentioned ethical AI. This is a very beautiful word. I mean, it's an attractive word, but we must define what is ethical AI. There is no, how can I say, clear definition, but for the matter of this proposal, of this presentation, I will work with the definitions that were recently provided by Floridi. He provided in many works, so I didn't put the date here. It was more or less defining ethical AI as we define bioethics, based on principles. So it's a principological definition. And what are these principles? I put the 5 most important according to Floridi. So you are seeing the screen. And particular, I'm very interested in these 2 principles here, which is justice and equity and explainability. Of course, all these are very important, and in all these principles there are a lot of research right now. But myself, I'm working on the methods tracking bias, and my interest is how to develop methods that can somehow identify just fairness decisions, how to explain things, and that's why I'm more interested in these 2 principles. The thing that I just mentioned, usually it's called the technical approach. It's not a good word, but I just put this word from the literature. It's the technical approach is the development of methods to mitigate bias or to make the decision more clear in terms of algorithms. Of course, there are a lot of limitations, and I try to discuss some of these limitations. So I will this is a very pedagogical. This is a classification problem, very essential problem in machine learning. So we have two classes, and here we are trying to granting a benefit, for example, a credit to someone. And here is the decision problem illustrated in this figure. So depending on the pattern, we are going to decide if we grant or not the credit, for example. This is a well-known problem, but how to formulate, for example, this problem in the context of fair classification, for instance. And then I will show some definitions before to change from this problem to the problem of fair classification, okay? So some important concepts here. Fairness, what is fairness? This is a very difficult discussion. So in the technical approach, again, we just assume some kind of definition, otherwise it's impossible to make math on that, let's say. So fairness, for me here, is the absence of any prejudice or favoritism toward an individual or group based on their inherent or acquired characteristics. So this is perhaps the most used definition in the technical approach, okay? What is protected or sensitive variables? Define aspects of the data that are social-culturally delicate for the application of machine learning. For example, gender, the ethics, the race, and the age, or where a person lives, for example, okay? And finally, the notion of privileged or non-privileged groups are groups that are defined by one or more sensitive variables that are disproportionately more or less, if it's not privileged, likely to be classified positively. So this is the definition that you use when you develop methods to make some, for example, fair classification. Okay? So this is the new problem. I mean, this is the classification problem, but now with all these new concepts introduced in the problem. So see, of course, you can see two classes. For example, if you are going to grant the credit or the benefit that people want to have, or a vaccine or a treatment or anything that you can relate it to healthcare, for example. But now we have also the notion of groups that are inside. So this becomes a very tricky problem to formulate and to solve with algorithms, okay? I won't go into details because of the time. I just would like to show this is how the very basics of how we think on this problem in the technical approach again. But it's a tricky problem. It's difficult. There is no clear solution. There are several solutions. By the way, these solutions, they are sometimes conflicting. So this is not easy, okay? Well, and just to, I try to make a link with the presentation of Rodolfo's presentation. Of course, these bias, where they come from. And Rodolfo, I'm just quoting him, just said that in a beautiful slide with Tarsila Amaral, that it must be representative. And this is one of the sources, perhaps the most important one in healthcare, I don't know, but we can discuss afterwards. But we can have no representative data or even prejudice in the data. So there are different types of bias, and we must face them with this algorithm, I mean, at least to mitigate them, okay? Okay, so the strategies of bias mitigation. Basically, there are three types. So we have a machine learning pipeline here, pre-processing, processing, the training data, the model generation, and the predictions. And now we divide the strategies of these methods for bias mitigation in three types. It's when we work on the pre-processing stage, or in the in-processing, in the learning of the system, or in the results given by a machine learning system. Sometimes you can merge two or more. We can think on a method that operates in the three that uses the three strategies, but it becomes harder. So people right now, they are, I'm working with pre-processing, I'm working with in-processing, the training, I'm working with the analysis, so we are pretty much segmented. And to be brief, this is more or less the way we think about the solutions. And just to show two examples, quick examples, what we are doing here at use regarding this problem. I've been working with fairness in unsupervised learning with several colleagues. And we are developing methods, for example, the classical decomposition to principal component analysis, PCA, which is very, very used until now. And we are developing fairness versions of PCA. So we must develop the algorithm, then analyze, and then test it. We are with that. And also, I'm very interested in this problem here, which is fair ranking. And this is a potential problem with applications in healthcare, because several decision problems can be modeled as a ranking problem. We must make some, we must prioritize, for example, as I said in the beginning of my presentation, we must rank in cities to have a given service or to have access to a given treatment or a vaccine. So I'm very interested in this problem of ranking, but when the alternatives to be ranked, they belong to different groups of people, of cities, of states. I mean, that doesn't matter. It can be, we can extrapolate this concept beyond people and can use this to provide some fair allocation of resources. So I'm very interested in ours to solve, I mean, to tackle this problem. And I'm very interested in analyzing the limitations, because there are a lot of limitations. And it's important when you give a method for decision aiding to tell the decision maker, okay, you can use it, but be careful. I'm very interested in the disclaimer part also, because there are a lot of parts that must be in the disclaimer, okay? So that's it. I tried to be faster as I could. Do not, thank you, I'll be glad to discuss the question.